I am so thrilled to take advantage of this Zoom environment and to have two colleagues, two people from the admissions area from the East Coast, from Columbia and Harvard joining us. And of course, we are always thrilled to have our very own UCLA Bruin programs represented, always invited to every single program that we have. So join me in virtually welcoming with virtual hand claps Amelia Ninova from UCLA Psychology, Keanu Ramos from Columbia from their med program with an emphasis in psychiatry areas, Amy Cohen from Harvard with their MD PhD program in some areas of psychology joint with that. And so again, welcome everyone. And I am Precious Robinson. I'm the UCLA Career Center's program director for graduate and professional school planning, which mainly means I just work with undergrads who want to go on for advanced degrees. And I also work with students with their general career planning and decision making. I am going to have our panelists introduce themselves and share a couple of highlights about their program so you know a little bit more other than, yes, these are top ranked programs in their areas. They're in superb areas where we all want to live and go, but you know, what are a couple of highlights that they definitely want you to remember if you're thinking about applying for their specific programs? And so I'm just going to start with how they appear on my screen, and we're going to start with Ms. Keanu Ramos.
Hi, everyone. So again, just thank you so much for having me tonight. So I represent Columbia University's Vagelos College of Physicians and Surgeons. We call it VPNS for short. I work in admissions. I've been an admissions and recruitment coordinator for a little under a year, but I've been with Columbia for about 3 years. I started off actually in student affairs. So some highlights of our school: we are the first medical school to host the white coat ceremony. We have over 70 co-curricular and extracurricular clubs. We call them the PNS clubs. They represent the vast majority of our students' interests and talents. In addition to that, we also have 4 programs in which you can apply into if you proceed to apply to Columbia. That is our regular MD, our Bassett track program, our MD PhD, and then our 3-year accelerated PhD to MD program.
Oh, wow. 3-year MD to PhD program. I'm looking forward to hearing more about that, as well as some other things about your program. Thank you, Keanu. Amelia Ninova from UCLA.
Hi, everyone. Thanks for inviting me, Precious. I'm really glad to be here, and thanks for everyone for joining. So I am the graduate admissions coordinator at the psychology department at UCLA. I've been in this role since 2018. And a couple of things about our department. It's one of the largest psychology departments in the country. Just to give you a little bit of an idea, we had about 60 faculty members who were recruiting students in this past admission cycle. And we do have more than that total. And we have about 180 grad students currently in our program. We have 8 areas of specialization, so there's a lot to choose from. We have behavioral neuroscience, cognitive psychology, clinical, developmental, health, learning and behavior, social psychology, and quantitative psychology. And we have, as if that wasn't enough, we have 3 minors in addition to that, which are diversity science, which is one of our newer minors, health psychology, and quantitative psych. And lastly, we just did a full renovation of our building, which was very exciting. So we haven't seen it yet because of the pandemic, but we're excited to finally be there in the fall, hopefully.
Oh, I'm excited to come see that. Wow. So is that right over near the inverted fountain?
Yes, exactly.
Okay, so I'm
Hall.
excited to see it again. Thank you.
Mhm.
Amy Cohen.
Hi, everybody. Thank you all so much for having me. I'm the administrative director for the Harvard MIT MD PhD program at Harvard Medical School. I have about 195 students in my program at various stages of training, and they're all Harvard Medical School students. Harvard Medical School has 2 preclinical curricula. One is called Pathways, the more common one, and the other is called Health Sciences and Technology, which is a physician scientist version of MD training. And And then we have our students are getting their PhDs at over 25 different PhD programs across Harvard and MIT. And a subset of them are in the theme of tonight, mind and brain. So we compare with neuroscience, neurobiology at Harvard Medical School. We have the MIT Brain and Cognitive Sciences PhD program. We have a population health sciences PhD program with a field of study in epidemiology that has a specialty in the quantitative psychiatric psychology focus. And then students in their have a clinical year where they decide on the specialty that they'd like to go into, and neurology is one of those, and psychiatry is another, but they're often a lot of overlap there. And then the students decide what specialty they'll pursue after they've completed the training, and go on to residencies in every specialty, including psychiatry and neurology. I'm trying to think if there's anything else to add about the program from this perspective. I think you know, that can be a good starting point, and I'll take from when we go to questions, we can get more specialized in that.
Oh yeah, that is a superb starting point. I think you said like 25 different areas, pairing with MIT, you know, definitely touched on what we're looking for this panel, all of you, in terms of matters of the mind and brain, different areas of psychology and psychiatry that's related to that. So thank you for that. So what makes a great candidate for your school or program, and you know, specifically around the areas that we're talking about in terms of those tracks or specialties that are related to psychology, psychiatry, neuroscience within your field? So what should students be thinking about in terms of what can build, you know, their resume or academic curriculum to be a good candidate for your program? And we'll start with the psychology program, and then go into our psych medical programs. Amelia.
Yeah, that's a great question. So we look for a couple of things. Sort of the two main categories, I would say, are your academic preparation coursework, and the other is research experience. So in our department, we only offer a PhD program. Students earn their master's degree along the way, but since it's a PhD program, it is research oriented, and that also goes for our clinical area. So I'll kind of go into each of these two. In terms of coursework, we're really looking generally for a psychology major or equivalent. I would say the majority of students who join our program will have a psych major, but there are also other closely related majors that definitely would make you eligible. Cognitive science, actually lots of different sciences are very relevant, and generally kind of a broad background in the sciences. And if you're not a psychology major, then, you know, we just recommend some courses that students can take to prepare themselves, kind of the core courses that you might take in one of those programs. And in addition to the coursework, also we do require a statistics course. In addition to that, as I mentioned, we look for research experience, and essentially, we look for research assistant experience that students have either in undergrad or beyond, so that they've worked with a faculty supervisor to, you know, at first you start off sort of helping out with the different projects going on in a research lab. And then eventually we hope that as you gain more responsibility, you become more involved at each stage of the research process and start to think about your own questions that you want to answer and that you want to, you know, collect data or use data that you have available to you to answer them, and take that initiative to think about, you know, your own project, take on an independent project or honors thesis or whatever you might have sort of available depending on your institution. So I would say those are kind of the two main aspects of preparing. And then we also look for contributions to our university's diversity mission. So we really want to have a variety of perspectives and backgrounds in research and academia. That's really important. So we look for that in our students as well. And the whole process for us is holistic review, which I'm sure others will talk about too. So we really look at the full package. But that is kind of the summary.
Thank you so much for that. That was very informative. Amy, how about at Harvard in your program, and particularly for MD, PhD track, what makes a good fit, a good candidate?
Right. So, reiterating what Amelia, am I saying that right? Amelia said, research is a really important component of applying for MD, PhD, as are the med school credentials. So our students are pre-med. There's a ton of pre-med coursework that needs to be taken. They're looking for clinical motivation as well. And that brings a point, I think, that's confusing for some people about physician scientists and what that means in terms of seeing patients and doing research, and a clinician scientist. So you could get a PhD in clinical psychology, and correct me if I'm wrong, because there's other people on this panel that are more expert on this than me, where you can be a clinician scientist and interact and see patients as a psychologist and do research as well. And so there's like an interplay between your patient care and the questions that come up and bringing them into a research setting. For a physician scientist, and if you're pursuing psychiatry or neurology, then you're looking at it from, and sometimes even in pediatrics, there's a lot of developmental psychiatry work that goes in with that, is a medical degree. And so how does one know what you want to do? And I think, again, I think you want to talk to people who are doing it. And I'm, again, not the expert on this. I'm an administrator sort of, in the operations of it. But from what I understand, applicants will put themselves in situations that can mimic it to the best of their ability. But like a psychiatrist is going to be engaged in providing medicine in addition to psychotherapies, where a psychologist would be focusing on like cognitive behavioral therapy or some other modality. And neurologists would be also looking at medication, but also other types of interventions. So there's a lot of our students will do shadowing, like maybe 100 hours of shadowing before they apply. And they will volunteer or work in settings that are similar to the fields that they're interested in. And we have students, I mean, volunteering is a luxury for a lot of people, and they don't have the time to do that, and they may need income. And some types of paid exposure to clinical care that I've seen applicants do is EMT work, or medical transcribing or medical translating. And you can find settings that are in the mind areas to focus on. I do remember a student in particular who did his shadowing for a full week in a psych unit in a mental health facility, an inpatient care place, and that really inspired him to pursue psychiatry. So for us, all of our applications go through the medical school first, and so they are looking for medical school criteria, and then if they're screened in by the medical school, then we are looking for the PhD criteria, and we're looking for exactly what Amelia was saying, in terms of having at least, I'd say, a year of research under your belt, depth of research, having a mentor that has had a chance to really watch you grow as a scientist, looking for drivers in the lab, people who are not just good technicians, but are part of the experimental design and are really driven by a very strong curiosity and perseverance. diversity is also across the spectrum in all the ways that can mean diversity of undergrad institution, of language, of upbringing, of everything.
Great, thanks for sharing that. Yeah, it's important to remember that there's, you know, diversity within diversity, right? There's a huge range of what schools are looking for in the area of diversity, and that students don't need to try to fit into some specific mold of that. They just need to be authentic when thinking about that area. So thanks for sharing that, Amy. Keanu, what makes a good fit for Columbia VP and S?
Oh, thank you. So Amelia and Amy kind of really hit the nail on the head with how they explained it. But again, for us, everything kind of comes through the medical school first. So for a good candidate for us is someone who will not only exceed in our curriculum, but has like a very vast majority of other interests outside of the sciences as well. So whether that be dance, music, anything, we love to see it, we love to read about it, and we want to know why you're interested in that. As far as that goes as well, we want someone who demonstrates integrity, the ability to relate to others, and have a genuine concern for the welfare of others. And so that's kind of just, you know, our main, as well as research and everything of that nature that was already mentioned.
That's fun. This is a fun panel. You're looking for those students that are juggling. Good for y'all. Juggling, real juggling, and juggling a lot of different activities, not just, you know, juggling Ming vases. There you go. So Amy, you started to touch on both of you, you know, all of you touched on admissions, but, you know, talking about going through the med school. Amelia talked about the holistic process. So if you all would, you know, delve a little bit more into detail in terms of your admissions process, what that looks like. You know, of course, you can't go through the whole thing in the time we have, but touch on some highlights. So whether you want to touch on the timeline, who's involved, do you have students involved, you know, faculty members, interviews, what are some main components that students need to know about the admissions process and what it looks like behind the scenes for you? So we'll start with Amy this time.
Sure. So for us, the medical school gets about 6,000 to 7,000 applications, and of them about 600, 700 will be MD, PhD. And again, they're looking first for medical school criteria, empathy, wanting to see patients is a major component of that. Leadership is a big component, and by leadership, I think really what they're looking for are people who are proactive, who see a need and try to fill it, who take initiative, and that can apply to anything. It can apply to sports or singing or dance or any other aspect of your life, and that they love they love the whole person. Like if you love cooking, whatever it is, weave that into the applications for sure. Once it gets to if the medical school wants to screen the applicant in to be interviewed, then it gets forwarded to our office. If it's a basic science, somebody who's interested in neuroscience, then it goes through a screening process with our basic science faculty. If it's a social science like the psychology PhD or the population health sciences EPI track that I spoke of that has the quantitative psychology component to it, then it goes to my office, and then I work with the PhD program directly to get a preliminary assessment on whether the applicant is competitive for their PhD program based on the PhD credentials. The rec letters are really important. Their research experiences, like having a longitudinal one. So we've seen applicants who might have 3 summers in 3 different places, and every semester they're changing. So like overall, they have a tremendous amount of research experience, but they would really like to see at least 1 year with the same mentor, like so that you have a chance to really fail in research and really like see that you love it. So of the 150 or so that come to our office, we interview about 80. We have about maybe 30 that come to our final meeting, and we make fully funded offers to about 15 a year. And so that's sort of like behind the scenes, what that looks like.
Thank you so much for that, Keanu.
Yes. So much like Amy mentioned, we review applications holistically. So yes, we love to see that you like cooking, and that, you love to dance, and that you love to do a lot of other things, as well as your research, any clinical experience you might have, any volunteer experience. So our secondary application goes live on July 1st. We do not start sending out interview invitations until about mid-August. And so interviewees who are applying into our regular MD program usually meet with 2 faculty members, and they'll have interviews with 2 faculty members. For our MD, PhD, and 3-year programs, it's a little more, just because we like our applicants to be able to talk to any faculty members that might be in their particular research interest. All decisions are made by our admissions committee, and I can also supply a list of who those are. We do keep them updated on our website. And then as far as COVID goes, because there was some changes, we are currently allowing online classes for the 2020 academic year, and for the spring 2021, as well as pass-fail. And then as this moment, we haven't decided if this upcoming cycle is going to be in person or whether it's going to be virtual again.
Thank you for that. And so there will be some differences for applying for a grad program at UCLA Psychology. What happens behind the scenes there? And this group might be a little bit more attuned to the pre-med track, so maybe even, some details on the GRE if that's required, or if the subject exam is required for psychology.
Yeah, so for us, the application opens in mid-September every year. We only accept students in the fall each year. So you have essentially one opportunity to apply. You apply about a year in advance. The applications are due by December 1st each year. And there are a couple of things, I guess, to mention about the process. So in the application, we ask students to indicate some preferred faculty mentors. Every year around early summer, we poll all of our faculty to see who will be accepting students. And so by choosing that in the application, then that flags your application for that faculty member. But generally, the decision is made by a committee of faculty from each of our 8 areas. So you do apply to a specific area and you are admitted by that area. So you have to decide in advance, whether you'll be applying to developmental psychology or clinical psychology or health. There might be some sort of similarities and differences between them. One of the ways that I usually tell applicants to think about, and if they're sort of choosing between different areas, is to think of a couple of professors that they would really like to have as advisors and apply to their primary area. And then, of course, to think about whether or not they're interested in doing clinical work and being interested in potentially being able to become licensed as a psychologist, because you can only do that in our clinical area. So that's another kind of major distinction between them. There are rare times when an application can be transferred from one area to another for whatever reason, but usually you want to, be pretty careful about selecting that in advance. And we do have interviews usually in late January, early July. Late January, early February. Already thinking about the summer. So this year they were 100% virtual, and we're not quite sure how next year will go. We're sort of taking it as it comes, like others mentioned. We might have some interviews be virtual initially and then invite a smaller group of applicants to be here in person, or we might go back to the way that we usually did it before COVID, which is that all of our students that we invite to interview would come physically to UCLA unless they had some kind of conflict, in which case they would Zoom in or do a phone interview. But in terms of number of applicants, we had a pretty different year this year. Normally we have about 800 to 850 for all of our 8 areas combined, and we would invite about 60 or so to interview, and then out of those we'll select about 35 to 40 incoming students, and that's again across the area. Some are larger than others, some are smaller. So in clinical psychology you might have 10 or 12 students out of those 38, and in a smaller area, maybe like health psychology, you might have 3 or 4. So this past application cycle, we had about twice as many applications, about 1,600 applications. And partly that could be, well, we don't know exactly why, but we did get rid of the GRE requirement this year. So it used to be required to submit GRE scores, and for the clinical area, GRE psychology subject test scores. And because of COVID, we waived that requirement. We are in the process of deciding now whether we'll reinstate the requirement or not. But our applications did go up a lot. We invited about 100 students to do virtual interviews, and the number that we are accepting, we haven't finalized yet. We will very soon, but I think it'll be about 40.
Yeah, that was a big leap. That would definitely impact me applying if I didn't have to take those standardized exams.
Yeah.
That's great. But in terms of those numbers across the 8 areas, are they pretty like similar or stable from year to year, or do they vary from year to year? Like you mentioned, clinical psych might be 10 to 12. Does clinical psych ever become like 3 or 4 any given year, or is it kind of stable?
It's mostly stable during the year. For clinical, I know that they also look for a certain number of students because they get a lot of their experience in our psychology clinic. So they are staffing the clinic. So they sort of have different, also numbers of, professors who are accepting students, but I would say the numbers stay pretty similar from year to year. As
I'm
far
sure.
as the distribution between the areas. Yeah.
Okay. I'm sure some students, like if the areas are somewhat similar, they might be looking at those numbers in terms of their strategy as well. So are those numbers ever published, or could they contact you to say, hey, what are the numbers looking like for these different areas?
Yeah, on our website, I have the overall numbers for the department, but they can always contact me and I can look into what they were for a specific area.
Thanks. And Amy and Keanu, I'm assuming that like for medical school, your classes are pretty stable each year, but is that correct? And again, I think each of you said you had about 180 in your class. Is that all medical students or your specific areas?
So for me, I have 195 total at all stages of training, but
Oh,
an
okay.
incoming class is anywhere from 12 to 15 funded. And then we actually have another group of med school students who join our program without funding for the first year. And they can be anywhere from like 4 to another 10 per class. And then, like Amelia said, for the students who are applying to us through the social sciences process, the PhD programs have a statement of purpose essay that's included in our HMS, our medical school secondary. And sometimes they do, it is mentor specific, where they specifically ask which mentors do you want to work with? And you have to be lucky to align well with a faculty member who happens to be taking students that year and not going on sabbatical or not full up on students. And it's there was a question in the chat about that. And that's a really good question because I don't know that anybody can know that in advance. I don't know if somebody else has anything to add.
Right. Yeah, I don't think that we would know that in advance either. As far as our class size goes, usually around 140 across the board. As far as psychiatry goes for us, you kind of decide that specialty after you've completed your major clinical year, is what we call our MCY. So you'll also have about 5 weeks of the major clinical year where you'll do a psychiatry clerkship. You kind of focus in on that to decide if that's maybe a specialty you want to pursue.
Great, thank you. And I know this is application week, so I am going to get back to those specific questions, but I do have to touch on this funding issue a little bit because that's been mentioned about fully funded. I know funding for grad school can be different. Maybe being a PhD, MD allows you access to different kinds of funding. So if each of you would share a bit about funding and how students can pay for these degrees that will pay for themselves eventually, but still, students want to know about this funding, I'm sure, as well. And so whoever wants to start first this time, we'll let you begin.
I can go. So, so we definitely have scholarships available. A lot of our financial aid is need-based. And so it kind of is on a case-by-case scenario, depending on what you need. We're definitely there to help you. If Columbia is a place that you want to go and we want you here to as well, we'll definitely make it happen.
Well, that was encouraging. Thank
Yeah.
you. Thank you.
So for us, I just want to tease apart two things. There's like people who are getting a straight MD, who might specialize in psychiatry, and again at Harvard, like Columbia, is need-based scholarship. For the MD PhD program, these by definition are generally fully funded. So if you're accepted into an MD PhD program, the intention is to fully fund you. We don't want you to go out into residency and then your postdoctoral fellowship and be like, oh, I could have a clinical career and make, $300,000, or I can go into a research career, make 100, 150. If you're saddled with, $400,000 worth of student debt, it's going to make staying in research, which you've just, spent 8 years of your life doing, hard. So the trying to keep our students debt free is a big part of our mission. And then to confuse things, as I said, we do have a subset of students in our program, which I think is an anomaly, where there's MD students who come to our program without funding from the MD PhD program for their first 2 years of medical school. And then they have to either pay out of pocket or they get scholarship from the financial aid office. The PhDs are fully funded, and then these students can apply for funding for M3 and M4 for us for the last 2 years of medical school.
Amelia?
Yep. For psychology, so the way it works generally is that the program is fully funded. Like others mentioned, what that means specifically is that in the first year of the program, all incoming students will get a fellowship that covers their tuition, both in state and out of state, and provides a stipend. And our funding level is $27,000 a year in terms of it's a combination of stipend and salary in our case, essentially. So in the first year, students will TA for our intro psych class for about 10 hours a week during 1 quarter of the 3 quarters that we have here at UCLA. And that forms part of their funding, a small part of it. The majority of it will come from the fellowship, like I mentioned. And then in years 2 through 5 of the program, we essentially guarantee students a teaching assistantship or research assistantship. So they can either teach for an undergrad class, or they might be a graduate student researcher, which is another type of employment with the university where they work with faculty on their research. And sort of in exchange for that, their tuition is covered, and they also receive a salary that goes toward that $27,000 funding promise that I mentioned. And we do always have students who come in with certain fellowships, like a NSF fellowship, for example, or they apply for lots of UCLA fellowships that we have as well. One of the big ones for incoming students is the Eugene Cota Robles Fellowship, and that's a diversity fellowship. And lots of others at UCLA. We constantly update students with different funding opportunities that they could, apply for, and they always have the TA position or student researcher position to fall back on if they don't have any external funding. So our goal, as Amy mentioned, is hopefully to keep students from having to take out loans. That is always, an option as well. But that is generally what our funding looks like.
And then, of course, depending on how energetic you are or how you manage your time, there are also other ways and niche positions. Because I'm at UCLA, I know more about ours. Like we have college academic mentors who also get funding, and they do like academic advising and mentoring with undergrads, and with the academic advancement program, grad students there. And even at the Career Center, we have graduate career consultants, and one of them is a neuroscientist that works with us. So there are different kinds of things. I'm sure at the other universities, they have these kinds of things as well. So you can research different ways to help fund yourself through gaining your graduate and professional degree. Okay, so let's go back to some areas of admission. So Amelia mentioned, for instance, like some students that aren't psych majors may have to go back and take core classes. So sometimes students aren't quite ready to apply, or they are, or they might have to, go back and shore up their resume. How do students know if they're ready to apply? And then for some common areas that you all see that students need to do, so whether it's take another class or get some more experience, how would they evaluate, and how would you recommend that they feel like some of those gaps? And then, for instance, I think for all of you, like when I went back for my psych degree, I was a sociology major. I took classes at a community college and at a Cal State. So students are wondering, is it okay if they take some of those classes at community college? So what are some common gaps that you see, and how can students feel those? And so, Amelia, since you started by talking about these classes that they might need to take, can you start for us this time?
Yeah, of course. Yeah, if you have any gaps in terms of coursework, so it depends on if it's sort of just a couple of courses that you'd like to sort of add to what you've already taken. You can take them at any accredited college or university. So it can be community college, it can be online, as long as the university is accredited, essentially. And then if you are more, I guess this is more specific situation, if you were making a career change, let's say, or you just thought you might be going into one area and then switched into psychology, then there might be more courses that you have to do. I also just want to throw out there that there are programs I think might be relevant to the other two advisors programs as well, that are called post-baccalaureate programs, which are meant to sort of help you actually fill your any gaps in coursework, and also provide access to research experience. So there are some programs that essentially are designed to prepare you for grad school, either in psychology or in different areas. So those might be worth looking into for some of you. And I would say another sort of key thing to keep in mind, like I mentioned, the importance of research experience. So that is a great way to gauge whether or not you're ready to apply. So essentially, grad students in the program sort of hit the ground running. They should be able to pretty independently start their research projects very, very soon after they get here. So feeling confident in that, I would say the best thing to do is, think about how much research experience you've had. Have you done any conference presentations? For example, here at UCLA, we have an undergraduate research conference, and lots of other universities have them. They're professional conferences that you can apply to as a student to present. Those are always great to have on a CV. Being an author on a journal publication, really, difficult to do, but if you've spent enough time doing research or contributing a lot to a specific project, then you can be an author, or you can write your own manuscript based on a project that you've worked on. So we're sort of thinking of those as goalposts along the way too. And I would say definitely talk to your own academic advisors. They'll have information about this. Talk to admissions advisors like us at different universities. We have, some similar requirements. Some will vary from one place to another. So it's a good idea to sort of talk to people specifically at those institutions, and then talk to your professors. And if you're already part of a research lab, to the grad students that are in the research lab, because they've already gone through the process. They know sort of what we're looking for. They can sort of help guide you along the way too. So tapping into, whatever network you might have that can, help read your statement of purpose, your personal statement, kind of take a look at your CV and be able to give you some advice.
Thank you. Kiana, what are your thoughts in terms of how students can assess their application readiness and a couple of suggestions for how they might fill some gap areas?
Absolutely. So, first off, just make sure that you performed well in your your prerequisites. We often notice that sometimes students tend to have some mishaps during their freshman or sophomore year. But we just want to make sure that you're going to improve academically, and that you demonstrated that academic improvement. So that's something that we kind of look for. As Amelia noted, you can always pursue a post-bac program if maybe your undergraduate degree was a little rocky. That's something that we also look at. Some factors students should consider is the amount of volunteer work they do, whether it be in clinics, tutoring, helping out in your community. Those things kind of stand out to us. That you've taken the MCAT within 3 years, that's a requirement for us when you begin to apply. Again, research, any type of research or clinical work that you can do, definitely that stuff stands out to us when reading your application.
Thank you for that. And of course, Amy, we want to hear your perspective as well.
Yeah, I mean, I can just repeat what they've said. They've pretty much covered it. If it's okay with you, Precious, I'm going to add it to the chat, like a bunch of links
Sure, absolutely.
to resources. So the first is these are physician scientist links. I'm not sure how helpful they'll be for people who are interested in straight PhD. A couple, the first two are just sort of like interesting things about physician scientists that are out in social media doing cool things. The HMS admissions and our admissions, but the AAMC links are really, really very helpful, especially for the MD and the AAMC MD and MD PhD, because it's really talking about it from like a national perspective, and they do a really great job of providing information. I know the MD PhD has a slideshow, is MD PhD Right for Me, that has really interesting data on the matriculants and on the applicants and the matriculants for MD PhD. So you can see sort of GPA ranges and averages and MCAT averages and ranges as well. Then just a little bit more about MD PhD at our institute. And then there's a link for post-bac programs that the AAMC has collected. So those are all very helpful things. And then the other opportunity I would share is summer programs. So if people are freshmen and the sophomores, juniors, you're still eligible to apply for these. And these are really great opportunities to get research experiences
Great, thank you for
network.
that really practical resources. And any of you, feel free to add to the chat or send to me later any resources that you want me to share with the participants. So let's go on into a little bit about the journey in terms of looking at the specifics for going into a clinical area, and especially as it relates to psychology or psychiatry related. So again, we know it's, for the long haul for med school. I think Kiana touched on when students might identify that specialty. So if you could, and we'll start with Amy this time, share with when students begin to, choose that specialty. Obviously, they're coming into your MD, PhD program, but then if they're, looking for that match in psychiatry, like what that process is, and how likely they are to get that match, or is there any concern of students not actually being able to make that match if they want to go into psychiatry?
Yeah, I would say it's a pretty much, if you're interested in it, you'll get the support you need to be successful in it. So there's the preclinical coursework, and then there's the clinical experiences. So every medical school across the country will have a clinical year. It's sort of like TAPAS, like a sample, like OBGYN and pediatrics and surgery and medicine, and then you have the flex months. I think that's pretty standard, where it's neurology, psychiatry, and radiology. And then from there, you do clinical electives and you explore. So you see, do I like neurology or do I like psychiatry in terms of like medical care and patient population and how you're interfacing with patients. And then and then from the clinical electives, you can specialize even more. And then there's all kinds of advising that's provided for our students through the hospitals, through the advisors in the medical school side, through networking within the program. So for example, for our program, we have a lot of students who are interested in psychiatric research and computational neuroscience and neurobiology. And so they have like a little community of people, and then they might have an event with all the students who are interested in that and all the faculty, physician scientist faculty in those areas. Or they might email me and say, oh, I'm trying to decide between these two specialties. And then I can find them alumni who have pursued either one of those and connect them so that they can talk to people who have chosen, the different careers and get some more nuance to their decision.
Thank you. Do you have anything to add to that, Keanu, or is there anything a bit different in your program?
Yeah, so like Amy mentioned, we have our major clinical year where you kind of get an introduction to all the courses. So whether that be OBGYN, psych, neurology, but for specifics of this, psychiatry. So you'll do like a 5-week psychiatry clerkship at one of our affiliated hospitals during that major clinical year. We also offer the Dr. June Jackson Christmas Medical Student Fellowship. That's a long name, I know, but it allows students a chance to really explore a career in psychiatry. And this is specifically for medical students who might identify as an underrepresented minority or ethnic group. There's also electives that you can pursue as well within our psychiatry department. We also have a psychiatry interest group on campus that's led by our Dr. Janice Cutler. Unfortunately, she couldn't make it tonight, but she's also a well-renowned resource. And I'll share her information with you, Ms. Robinson, so that way you can share with everyone else as well. But we do have a host of opportunities for students to kind of get involved and get their feet wet in psychiatry.
Okay, thank you. So I'm going to go to a little bit of a speed round and try to squeeze in 2 or 3 more questions. So if you could try to address these next round of questions in a minute or less, which might be kind of tight, but we'll go for it and see. Maybe a little bit longer for this first question. But I'd like for each of you to select a different document that's needed for admissions, and then whoever wants to go first. So whether you want to address the personal statement, the statement of purpose, letters of recommendation, resume, so a specific, document or aspect that's needed to apply, and tips that you would give for that. And if each of you would address a different one, so not everybody personal statement. So whoever goes first gets to choose which one they would like to address. Keanu's like, I'm ready to
I'll
go.
go
Let's do it. Go for it.
I'm actually going to start with the letter of recommendation. So we think the key to an effective letter of recommendation is making sure that your writer knows you on a personal basis. This really helps our committee members know what your personal characteristics are and really speaks to the genuinity and the authenticity of who you are as an applicant. So when you select your letter writer, make sure that they're familiar with you, because when they're not, it kind of comes off a little more flat or general or basic. And then in regards to PNS, we really love that applicants come off really authentic. That's just us.
Thanks. I actually hear that a lot. I think we all want that authenticity, not like trying to look for some unique story or embellish some story to stand out, but it's the authenticity. So I'll second that.
Yes, just for you. We want to get to know who you are.
Mm-hmm. And who would like to go next? All right.
Well, next, I was going to mention the resume or CV. I would say my best tip for that would probably be to make sure that when you list a project that you've worked on or a position that you've had, to really talk about how you contributed to it. So not only describe what the project was, but also what part of it did you take ownership of, or what part of it were you responsible for? And that can apply to each of, the different types of positions and experiences that you list on your CV. That would, yeah, that would probably be the best thing, and be, succinct, but give us, we do ask for a CV, so it can be a couple of pages, but keep in mind, everyone's time when they're reviewing the applications, and they review hundreds and hundreds of them. So try to get your point across, in sort of a clear, succinct way. But I would say, specifically talking about your own contributions, if the faculty who are reading your CV can get a sense of why admit you to the program, not just anyone who worked on this project, let's say, but what did you bring to it that was unique, and that's a specific skill that you would bring to our program.
I second that.
Yeah. Of course, everybody's points are applicable to us as well. And I would just add for the essays, like I would make sure to take advantage of your writing support that you have at your home institutions, and take a writing class. So learning how to craft a sentence and a paragraph and a narrative is a teachable skill, and it is going to serve you really, really well to give yourself the time to focus on your writing skills. So as everybody's pointed out, people are reading thousands of applications. I've never heard a faculty, I'm a fly on the wall, I'm not a decision maker, but I've never heard a faculty member say anything negative about anybody's writing. So I only say this from having read the essays of the applications that get accepted, and how just so compelling and beautiful they are. So I think that I think it's sort of an underappreciated skill on top of all the science and on top of your clinical experiences and your dancing or juggling or singing that you do. Be a real Renaissance person, but really make the time to hone that skill. And then the other piece of advice I would give relative to the rec letters, and I'm going to tie that into finding mentorship and really finding a champion for yourself, and a cheerleader in your and a coach in your research endeavors. And I have a bit of an anecdotal story, and I hope it's okay if I share this. So I'm not a scientist, and I'm operations, but I have a colleague who got her PhD in education. So she's an administrative director, and then she ended up getting a PhD in education. And she told me the story about going to the ed school and meeting all of the faculty to be her dissertation advisor, and they just weren't really getting jazzed and excited about her idea. And she just kept looking, went through the entire faculty list, and then started going to the emeritus list, all the people that had retired in the last 10 years. Finally, she found somebody who was super excited about what she wanted to do. And she's like, oh, can you come out of retirement to be my dissertation? And she did. And now she's this woman's an administrative dean and she's the world's expert on physician scientist mentorship and training. And it really struck me, because I know I would have tried the first, 5, 10, maybe I would have done 10. And then they would have been, oh, I guess it's not a good idea. And I would have just imploded on my own insecurity.
I love that story. That is great resilience and resourcefulness.
Right. But it's just really
awesome.
you all come to that drive is unique, and it's special, and it's powerful, and there's somebody out there that's going to help cultivate that. And if you don't have that yet, keep looking. And
absolutely. So we have about 4 minutes. So I do want to move along to a couple more questions. Thank you, Amy. Yeah. That's an awesome question and story, though. I do want to honor a pre-question that came in from a student about gaining experience, clinical experience, especially in psychology, for instance, that can be so hard to find. I often maybe I shouldn't joke with students about this, say that even if you graduate with a degree in psychology, you can do anything except be a psychologist on the undergrad level. So I'll throw this to UCLA. So Amelia, do you have any suggestions for students if they want to go into clinical psych, during their gap year or some other time? What might they do to gain some experience outside of research? Do you have any thoughts or some things that you've seen that students have done that have been admitted to your program?
Yeah, so it can be really difficult. So because research is the focus of the program, that's really what we'll look for primarily. And we do know that clinical experience can be really difficult to come by. So it's not a requirement to have it to apply to our program, but of course it is nice. And I think it's probably most helpful to you as the applicant because it can really help you decide, is this right for me? Is this the field that I should be going into? So I would say probably two things. One, try to find volunteer opportunities. So even if it's something that sort of a community clinic in your area or some organization on campus that you could potentially be involved in that might have some additional resources. And then also talking to your professors and sort of, again, trying to make the most of your network to see, they definitely have lots of colleagues in this area. They are able to potentially connect you with someone. And, just cast a wide net, definitely reach out to lots of people, follow up with them, as we've mentioned, how important it is to take that initiative. But those would be sort of some of the opportunities, I guess, some volunteer opportunities, shadowing sort of opportunities, and then talking to people in your network who might be able to connect you with someone. But like I mentioned, it's not a required aspect, but it is also something that can come along with some of the research that you do. So you will, get to know psychologists and psychiatrists and lots of people if you're involved in clinical research. So then there might be sort of other areas you can explore and to get a bit closer to the hands-on sort of clinical side than you might otherwise.
Okay, thank you for that. So we're going to end this moderated portion with just a round of, any parting words, although it may not be your parting words because we're going to go into the breakout rooms after this for until 5:30. So parting words, something that you want to address that you haven't had a chance to yet, and then maybe one reminder or highlight about your program that students want to think about to encourage them to come around to your space during the breakout. And we'll start with Keanu. Parting words of advice and.
Thank you, Precious. So my parting words would just be to never give up and always give your all, no matter what. There's definitely a school out there for you, even if it isn't Columbia or Harvard or UCLA. There is some place out there for you. So definitely don't give up. Get involved. Involvement is something that sticks out, I think, across the board to everyone. So whether that's clinical, volunteer, research, anything, just make sure that you're out there applying and doing your best. And then again, for us, there's 4 tracks that you can apply into. We have a host of co-curricular and extracurricular programs, and we even have student-run clinics that are supported by our faculty.
Thank you. Amy.
Well,
you gave a lot of great advice with that wonderful story you told. So
right.
Yeah, you can get a pass on that. But if there's any other highlight you want to remind students of about the
no, I guess I would just say, I'm again, I don't know if I'm like bypassing things, but my email's in the chat. And if anybody's interested in MD PhD training and wants to reach out to me after the event, and I know that there's a meet and greet or a breakout session after this, but either way, I'm always happy to talk to people. So
yes,
and connect people, right, and connect people to students, and I think that's also very helpful for people.
Absolutely awesome. Yes, feel free to share your emails. Again, share any resources in the chat or in your breakout rooms, or forward to me and I can send them on as well. Thank you. And last but certainly not least, our Bruin, our Amelia Ninova.
Yeah, I guess as just some last words, I would say to keep in mind that this whole process is very long. You're in it for the long haul, like we mentioned. It can take a couple of years sometimes to really even prepare yourself to apply, to go through the whole process. So just to have that, perseverance and sort of taking it one step at a time. Eventually you'll get there. And like we mentioned, you'll find a program that has faculty that are doing what you're interested in doing, opportunities that you want to take advantage of. So just stay focused on the goal, but take it one day at a time. And yeah, if anyone's interested in our 8 specializations in our PhD program, I can tell you more about that. And I'll also post my email in there in case you want to reach out.
All right, thank you all. Yes, students, give them a virtual high five, applause, and all of that. And I'm going to stop the recording now unless it's already been stopped. I don't see that. Okay. I'm going to stop the recording. There we go.